Have you ever heard of a condition that causes this painful, almost stubborn kind of fat to build up, mostly in women? Fat that just doesn't respond to diet or exercise? Well, it affects millions of people, but it's often misunderstood or even misdiagnosed for years. Today, we're diving deep into the medical mystery of lipedema. And that's the question, isn't it? For so many people, this is the thought that runs through their head. They're doing everything right, they're eating healthy, they're working out, but the fat on their legs and arms just won't budge. And worse, it hurts. This question is really the beginning of a journey to realizing that this isn't a personal failure. It's a real medical condition. All right, so here's our game plan. First, we're going to unpack this whole mystery of painful fat. Then, we'll sort out how it's different from other conditions it gets confused with. We'll peek under the skin to see the science, talk about how it's more than just a physical thing, and finally, we'll look at how it's actually managed. So, what is this thing really? It's a condition that can often be traced back through family history, and it usually kicks in around big hormonal shifts, like puberty or pregnancy. Let's break down the classic signs. Okay, so here are the telltale signs that really set this apart. The fat builds up symmetrically, so on both legs or both arms, but then it just stops, right at the ankles or wrists. This creates what doctors call a cuff sign because the hands and feet look totally normal. What's also really unique is that the tissue itself is tender and it bruises so easily. And the big one, of course, is that this fat just doesn't respond to diet and exercise the way typical body fat does. You know, one of the biggest hurdles for anyone going through this is just getting the right diagnosis. Why? Because lipedema is so often confused with lymphoedema or just general obesity, and telling them apart is absolutely critical. First, let's define lipedema again. And here's the most important part. It's not just a fat disorder. It's a disease of the loose connective tissue. That means it's about the whole support structure, the framework that holds the fat cells, not just the cells themselves. Next up, lymphoedema. This one is basically a plumbing problem. Your lymphatic system is like the body's drainage network, and in lymphedema, that network is blocked or damaged, so fluid backs up and you get swelling. And finally, obesity. Now, this also involves excess body fat, but the key word here is generalized. The fat is typically distributed all over the body, the torso, the hands, the feet, not just packed onto the limbs in that disproportionate way we see with lipedema. This chart just lays it all out so clearly. Look at the column for lipedema. You've got the symmetry, the pain, and that classic sign where it spares the hands and feet. Now compare that to lymphedema, which can often be on just one side of the body, or obesity, where the fat usually isn't painful and it does respond to diet. Getting these distinctions right is everything for a proper diagnosis. Okay, so we know what it looks like from the outside, but what is actually going on inside the tissue that's causing all this pain, this swelling, and this frustrating resistance to weight loss? Let's dive into the science. I know I sound like a broken record, but we have to keep coming back to this. Thinking about lipedema as a disease of the whole connective tissue system, not just the fat, is the absolute key to understanding everything else. So how does this all go down? Well, it seems to start with these tiny, fragile blood vessels that get leaky and seep fluid into the surrounding tissue. That leakiness triggers inflammation. Over time, that constant inflammation leads to fibrosis, which is kind of like internal scarring that makes the tissue hard and lumpy. And here's the real kicker. The space between the cells gets filled with this gel-like web that acts like a sponge, trapping water and sodium. That's why the limbs feel so heavy. And it's also why typical water pills just don't work. You know, living with lipedema is about so much more than just the physical symptoms. This condition has deep connections to the rest of the body, and it carries a really significant psychological weight that for a long time has been totally overlooked. I think this official definition of pain is just so powerful. It confirms that the pain of lipedema is real and it's complex. It's not just a physical sensation happening in your leg, it's an emotional experience that's being shaped by everything else going on. And get ready for this stat because it is staggering. Over 30% of lipedema patients also have hypothyroidism, an underactive thyroid. For comparison, that number is only around 2% in the general population. This is no coincidence. It's a huge clue that lipedema is tied into the body's entire hormonal and metabolic system. And the emotional toll, well, it can be immense. Imagine being told for years that this is somehow your fault, all while you're dealing with chronic pain and a body that's changing in ways you can't control. It's no wonder that anxiety, depression, and even eating disorders are so common. This psychological burden is a very real part of the disease. Okay, so we've spent a lot of time on the problem. Let's shift gears and talk about solutions. Now, while there isn't a cure for lipidemia yet, there is a whole comprehensive approach to managing it, to easing the symptoms, and to taking back some control. And that's really the point, isn't it? The goal is all about improving your quality of life. The focus is on three key things: calming down the symptoms like pain and heaviness, making it easier to move and function day to day, and, importantly, stopping the condition from getting any worse. The first line of attack is often called conservative therapy, and it really rests on four pillars. First, compression garments give the tissue support and can really help with the pain. Second is gentle movement. Think swimming or water aerobics, which acts like a natural pump for your lymphatic system. Third is nutrition. Adopting an anti-inflammatory diet can help manage symptoms from the inside out. And finally, psychosocial support, because addressing the mental and emotional side is just as important. So when we talk about nutrition, the big idea is to reduce inflammation and avoid big spikes in blood sugar and insulin, which can make things worse. Some studies have actually shown that diets low in processed carbs, like a ketogenic diet, can make a real difference in pain and inflammation for a lot of people. But the key is finding an approach that's sustainable for the long haul. For some people, there's also a surgical option, a very specialized type of liposuction that's designed to spare the lymphatic system. And it can be life-changing, seriously reducing pain and stopping the disease from progressing. But, and this is a big but, it's a major surgery with risks. It absolutely has to be done by a surgeon who really understands lipedema, or they could end up damaging those delicate lymphatic vessels. Look, if you take only one thing away from all of this, let it be this. Lipedema is a real, diagnosable physical disease of the connective tissue. It is not, I repeat, not caused by a lack of willpower or a failure to diet. Understanding that is the first and most important step towards empowerment.
And that is such a hopeful message, because this is not a story of defeat. It's a story of management. By putting together the right plan, the therapies, the nutrition, the medical support, it is absolutely possible to manage this condition and live a full, happy, active life.
You know, with all the new research happening, with patients advocating for themselves, and with more doctors finally becoming aware, the future for lipedema care looks so much brighter. This painful mystery is finally being unraveled, and that offers so much hope to millions who've been suffering in silence for way too long.